My name is Dr. Priscilla Ibekwe. I work in Nigeria Center for Disease Control and I lead the National Cerebrospinal Meningitis Technical Working Group. This is a group of experts that are working on meningitis, which is a big global issue and a big public health problem in Africa. 26 states in Nigeria are within the African meningitis belt. In 2016-17 season, 14,500 people were affected by meningitis, and sadly, about 1,200 deaths were noted. And we're very conscious about this, and we are working very hard to ensure that we don't have those numbers again. And as a technical working group, we have developed the national guidelines for meningitis. We're working with states to ensure that doctors are trained in case management, in collecting samples for investigation and confirming cases of meningitis. We're also supporting states to develop their preparedness and response plan, and having commodities and putting these treatment, medicines in the hospitals at the right time to be able to deal with outbreaks if they occur. I'm very delighted to say also that Nigeria has also started a routine immunization with meningitis A vaccine, and we're beginning to see drastic reduction in the numbers of people that have been affected by meningitis. I'm very delighted and motivated to work in this arena because I recall as a child in secondary school when I was given a prophylaxis, I was given tablets during meningitis outbreak, and when I went to see our students in hospital who were ill, I was sad. I recall being sad when mothers were crying because their child had died from meningitis or were having complications of meningitis. So there's always something that all of us can do. We do all have a role to play in defeating meningitis. It's important for everyone to know the signs and symptoms of meningitis, which includes fever, irritability, drowsiness, neck stiffness, sensitivity to light. And if people develop this type of symptoms, they will quickly go to the hospital. We encourage them to go to the hospital and get treated. This is very important because meningitis is a race against time, because up to 50% of cases of meningitis untreated will die. And even when treated, up to 10 to 20% may have complications of meningitis. So it's important that we have all states have a comprehensive package of care, which includes the treatment of the patients, having aftercare facilities to deal with the complications of meningitis. Some of these complications include deafness, loss of limbs, loss of vision. It's important for the education sector to also have services and facilities to support children as they come back to school. Not only that, we also need to support their parents, because they are dealing with this long-term disability. Also, it's important that communities come together to support parents affected by meningitis. We all have a role to play. Together, we must take action and defeat meningitis.